Today I'm very pleased to present here a summary of my presentation about the cognitive disturbances that we often see in patients with major depression. So the main problem is that many of our patients have cognitive problems that are not those that traditionally we believe were related to aging or maybe the start of Alzheimer's disease or something like this, but actually it's a problem that is even in young people is common in depression. So what we see is that patients with depression not only show the traditional mood symptoms of low self-esteem, sadness, apathy, and so on, but also difficulties to remember things, difficulties to concentrate, difficulties to take decisions, etc., which are related to cognitive problems. These sort of problems we also see in other mental disorders such as schizophrenia, bipolar disorder, anxiety disorders, and so on. So it's not something specific to depression, but the importance of those symptoms is that they are very correlated with the functional outcome of depression. So some patients may improve quite a lot from the mood symptoms and feel okay, but unfortunately they don't do well, because they cannot go back to work, they cannot perform as they used to before being depressed. They are somewhat impaired cognitively and functionally. So nowadays there is a great awareness of the importance of these symptoms, and what I'll be presenting is the potential solutions for this. So there are treatments that may be better than others to treat these cognitive symptoms, and there are also interventions, psychotherapies, that may be good to treat these symptoms. And that the main message is that cognitive symptoms are important and can be treated.
And could we sign 5 or 3 symptoms in healthy people, in young people, to detect depression and the risk of suicide?
Well, certainly, besides depression, which is the main cause of suicide, there are other reasons for suicide. Also, the cognitive symptoms are related to suicide. So it is important not only to detect depression, but also to detect cognitive problems and the risk of suicide. My recommendation is that if we see any person, especially young people, who have changed their functioning in terms of they are not going to the university, they stop studying, or they become more isolated, more lonely, or they don't communicate with their friends, etc. And they also complain about difficulties in concentration, or helplessness is very important. If they lose the hope, hopelessness and helplessness are very critical points, then these people may be at risk of suicide. So it is very important to be aware of this, because there is no perfect way to predict suicide. Suicide is difficult to predict. The only thing we can do is to treat depression early. That's the main solution to prevent suicide.